Our patient is a 32-year-old woman diagnosed with possible thoracic outlet syndrome. She has a past medical history of osteoarthritis, mitral valve prolapse, and exercise-induced asthma.
Okay, so the treatment today being performed on this patient, we're going to be stretching the extensors in the arm. We're going to be doing a pec stretch and a scaling stretch. We're also going to be performing some mobilization as well as some posture retraining, HEP, and the Allen's test. Okay. Hi, Miss Nikki. How are you doing today?
Fine, thank you.
Good. Well, my name is Kaci Krause, and I'm a student physical therapist assistant.
Okay. And I'm Marissa. I'm also a student physical therapist assistant.
And we're going to be treating you today. Is that okay?
Good. Yes.
Okay. All right. Well, first of all, are you having any pain today?
Just some, yeah.
Okay. On a scale of 0 to 10, what would you say your pain level is today?
Today, probably just about a 4.
About a 4? Okay. All right. Well, we're going to do some stretches to start out, okay? Because I know you've been having some pain, and you work a lot, and you're sitting at a desk. Right. So we're going to do some stretching to kind of help with that.
Okay.
Okay. All right. So the first stretch that I want you to do is I want you to uncross your legs for me.
Okay.
Okay. And I want you to take your left arm.
Okay.
And I want you to hold that mat. Okay.
Okay.
Now with your right arm, I want you to bring it over your head and grab the side. Yes.
Okay.
Grab the side.
All right.
And I want you to gently pull. Okay. And
Which
I want you towards your shoulder.
Okay.
Okay. The shoulder that is holding your head.
Okay.
I want you to pull it that way. Okay. And as you're doing that, I want you to look up at the ceiling with your eyes.
Okay.
And I want you to keep your body straight though. We're just going to be stretching your neck. Okay. We're going to hold that for 30 seconds. Okay. Okay. And I'm going to count for you. Are you feeling any pain with this? You shouldn't feel a sharp pain, but you'll feel a stretch.
That's what I feel.
Just a
pulling.
stretch? Okay, that's good. Okay. All right, you can relax for a second.
Okay.
Do you think you can do this one more time for me?
Yes.
Yes. How's that feel? Does it feel a little bit looser?
It does.
Okay.
I felt it popping.
Popping? We don't want popping, but we do want it to stretch,
Yeah,
okay?
I can feel that.
Okay. All right, let's do it one more time, okay? All right. Hold that. Make sure you keep your trunk straight for me. Just stretch your neck. Okay. Do you feel that pull?
Yes.
Okay. I'm going to hold it for 30 seconds. And no sharp pain, just a stretch.
Correct.
Okay, that's good. That's what we want. Okay, got about 10 more seconds. Okay. Does that feel pretty good?
It does.
Okay. No pain right now? Doing okay? Alright, well we're going to come over to this chair right here for our next stretch.
Okay.
Okay, and what I want you to do is have a seat right here for me. Okay, and I want you to put your left arm on the table, like so. And I want you to keep both feet flat on the floor.
Okay.
And I want you to lean forward slightly, bending your trunk and sliding your arm forward. And keep it straight, just like that. Okay, do you feel a stretch?
In my back?
In your arm, do you feel a stretch in here?
Yes.
Okay. Alright.
Do I stop or keep going?
You step right here.
Okay.
Okay, do you feel a stretch right here?
Yes.
Okay. I want you to hold that for 30 seconds, okay?
Okay.
Okay, 10 more seconds. Okay, go ahead and come back up. And we're going to do it one more time, okay?
Okay.
Okay, whenever you're ready, we're going to do it one more time for 30 seconds.
Okay.
So slide your arm forward. Keep that arm straight. Okay. Okay, hold it right there.
Okay.
seconds. You feeling okay? Just feel a stretch, no pain?
Correct.
Okay. Okay, you can go ahead and sit back up for me.
Okay.
Okay, and now what I want you to do is I'm going to take this towel, okay, and I'm going to drape it over your left shoulder.
Okay.
And then this part is going to come and you're going to sit on it. So can you raise your bottom up for me? Okay. So I want you to take this hand and grasp the towel, okay? And I want you to relax this arm, okay? And what I want you to do is I want you to pull this towel towards this hip, okay? And I want you to, keep your back straight for me and just pull, not pull it too hard, just kind of gently pull it,
Okay.
okay? Just relax that left arm.
Okay.
Okay, we're going to hold it for 30 seconds. That feeling okay? Okay, just keep holding it. Got about 10 seconds left. Okay, relax for just a second and we're going to do it one more time. Okay? Whenever you're ready.
Ready.
Okay? And if you'll try to look up at me while you're doing it.
Okay.
About 10 more seconds. Still doing good?
Okay.
Okay. Alright, we have one more stretch, okay?
All right.
You're not getting too tired on me, are you?
No.
Okay. Alright, we're going to go over to this corner, okay? Just you'll follow me this way. We're going to do our last stretch over here. Okay, so what I want you to do is I want you to take your arms kind of in a formation like this, okay? I want your feet about shoulder width apart, and I want you to just gently lean forward, and you should feel a stretch in this area, okay? So if you'll do that for me, let's put your hands up like this, okay? All right, go lean forward just a little bit for me, okay? You feel that stretch?
Yes.
Okay. You can come back just a little bit. There you go. Okay? You'll hold that for 30 seconds. Any sharp pains or just a stretch?
Just a stretch.
Okay. Ten more seconds. Okay. You can rest for just a second and we're going to do one more, okay? Just whenever you're ready. Okay. So arms like this. There you go. Just lean forward just slightly. Okay. Hold it for 30 seconds. Ten more seconds. Doing good. Okay. How'd that feel? Pretty good?
I feel it pulling.
Okay, that's good. That's what we want. We're going to come back over here to your chair and we're going to work on some posture training, okay? Since you're at work all day
Yes.
and sitting in a chair, we want to make sure that you are in the correct posture. So if you'll have a seat and Marissa is going to come work with you, okay?
This is probably what I need the most because my posture.
Yeah, actually, let's scoot your chair up just a little bit. We want to be in front of that mirror. There we go. Okay, there you go.
All right, now we're going to do some posture exercises
Okay.
with this towel. So I'm going to do first, I'm going to have to place my hands on your hips. Is that all right?
Sure.
Okay, so if you'll look in the mirror and just kind of relax like you normally would sit.
Okay.
So I'm going to show you first coming forward. So we're going to scoot your hips a little bit and see how that gap widens there at the chair. And then we're going to go the opposite direction and see how your back kind of flattens out. So I want you to find, we're going to go back a little little bit, and we're going to find that neutral position of your spine there. And that's what I want you to try to keep, during exercises throughout the day. And then with your shoulders, you're sitting pretty good, so keeping your shoulder back and then your chin. So now if you look in the mirror, you can see your posture, how your shoulders are back. So that's the posture that you want to maintain, right?
Yes.
So at work, when you feel like you're getting tired, or I know you're sitting at the computer a lot and work throughout the day, like you tend to, gravity, and you're tired, your shoulders tend to roll. So just being mindful of that and trying to keep your shoulders back and your chin back. But if you do find yourself getting tired, you can use a lumbar roll, or just this is just a rolled towel. You can place it right there behind your back, and do shoulder. Yes. So you can do that at work.
Yes.
And then we're going to do the same thing while you're standing. So I'm going to move this chair. And same thing, you're just going to stand sideways in the mirror. Okay. And I just want you to kind of relax in how you normally stand. Okay.
Okay.
And then, okay, so you're standing good right now. So again, keeping that shoulder back. And then your chin back just a little bit. Good. And we'll do your hips again so we feel. So when we go forward like that, you see all this curve in the mirror goes further, bigger, and we go back and it flattens out your back. So again, finding that neutral position that's comfortable for you and trying to maintain it.
Feels good.
Feels good? Good. Okay, now we are going to, there's just one more thing. You can have a seat in this chair. I'm just going to do one more test on your left arm. Okay. I just have to find it just real quick. Okay. I'm just going to raise your arm up. Okay, and if you could just look to the right for me. Good. All right. So now we're just going to talk about your home exercise program for you. I know you're busy with work, so you might not be able to come into PT as much. So we did some self stretches with you, and all of these can be done at home. We had the table stretch for you, the one where you're lying and leaning forward in the chair. The corner stretch, so just find a corner of your home and you can go up to it, and that will stretch your pec major. And then the scaling stretch, which
How many repetitions would you think I need to do?
right. So you can do these as many times as you want throughout the week, as much as you can tolerate, but we don't want it to cause any pain. So if you're feeling pain, don't do them. But and then the mobilization, the one we did with the towel, right? And then Casey's going to talk to you about a TENS unit. I can also use at home.
So this little unit right here is called a TENS unit, and it's basically, it makes your arm kind of have the tingling in it. It's the electrical current, and it's to help with your pain, to help relieve pain. So do you have a pacemaker, any heart problems? Do you have blood clots? Okay, do you have a history of cancer? And could you possibly be pregnant?
No.
Okay, so that's great. So this would be perfect for you to use just at home when you're relaxing and you just want to relieve that pain. So I'm going to kind of show you how to work it, okay? So what we're going to do first,
Is it something I have to wear?
you put it on your arm.
Okay.
These little pads, these little sticky pads right here, just go on your arm. And then these cords will hook up to it. And then you just turn on the machine. And I'm going to show you how to do it. But first I'm going to put these little sticky pads that are called electrodes. Okay? And I'm just going to stick them on you. So we're going to put them one right here. Okay? We're going to put one back here. One about right here. One down here. And if you need help at home, I'm sure you have some very lovely grandchildren,
Right.
or children who would, love to come and help you out. So I'm sure they could come and help you get this set up. If
Okay,
you have problems with it,
just let them know.
just let them know. Okay, so these, what we're going to do is we're going to hook, see how they're a channel,
Right.
and then a channel, how they're kind of connected. So we're going to do one here.
No matter which
and
color.
one here. So
Or did
it doesn't matter on the color, but we want, see how this is one channel?
Mhm.
We want those in a line,
Okay.
okay? And then over here, same thing. And if you want to do, it doesn't matter on the color. It's just, as long as you have them kind of in line with each other, okay? All right, so now you're going to press the power button. Okay? And so if you'll just hit this little button right here, set up, and you want it on the NMES. Okay? And if you'll hit the next button, and then if you'll hit the PPR button right here, and hit next. Alright, and we're going to do for pain. So you have a little guide right here for you that kind of tells you. So you see number 7 says for pain.
Yeah.
So we're going to scroll up until it says 7. And then it's got it set for you. So that's pretty simple for you. You don't really have to do a whole lot. You just kind of follow that little guide, okay?
Okay.
And so here, these are our channels. So you want them to be even. So I'm going to start increasing. You're going to feel a little bit of a tingle sensation. So I'm going to start increasing, and you tell me when that is comfortable. You want to feel a tingle, but you don't want it to be painful.
Okay.
So I'm going to start increasing. So you want to do it on that side, and then that side. Same thing. You want them to be going up kind of the same number. You feel anything yet?
Mhm. I'm just beginning to feel it kind of tingle.
Okay, well you tell me when that feels comfortable for you.
Right here.
Right there?
Maybe down just one, because that
Down
seems
one.
a little.
Okay. So that's exactly how you would do it at home. You would just set it up like that. That's pretty simple, right? Not too bad. Alright, well I'm going to go ahead and turn this off, okay? And so when you're at home and you want to relieve your pain, you can get this out and hook it up, okay?
For about how long?
You can do it for about 20 minutes, okay? Or however long you can tolerate.
It's nothing I can leave on all the time.
You don't want to leave it on, all day, but if you just want to do it for 20 minutes or so, you can. Or if you can't tolerate it that long, you can do it for 10 minutes. Alright? Let me go ahead and unhook this from you. So how did your treatment go today? Did you feel pretty good about it? Alright, so what's your pain level right now on a scale of 0 to 10?
Probably about a 2. Maybe
A
I
2?
feel a little more relaxed.
Okay, awesome, great. Alright, well thank you so much for letting us work with you today. If you have any questions, just let us know, okay?